Hello?
The Bondi Clinic has just received a call from a worried babysitter who's looking after a friend's turtle.
Yeah.
And her golden retriever's actually picked it up and bitten through the shell.
I'll head over there now.
Thanks, Chris.
Okay, that's all right. Hello.
Hello, how are you?
Going?
Yeah, good,
You got the turtle?
Yes.
Yeah, all
yes.
right. Where is it?
Right, upstairs. Come on, thank God you're
I'm
here.
Chris.
The dog took a liking to the new family member and thought he'd have a little taste. And he's put a few holes in him.
Is this him begging?
That's just him wanting attention.
I think it's him wanting something else, actually.
Homer's owners are away for
go.
3 weeks. This is the turtle's very first day in Jodie's care.
It's very clear that Coda is absolutely obsessed by Homer, and when he saw his chance, he took it. There's 2 big puncture wounds here, but also he's had a few little goes here trying to get his teeth to grip into the shell.
Oh, well, I nearly threw up, to tell you the truth. I didn't know where to go, where to run or who to ring But we decided to ring Bondi Vet.
No, don't beg. It demeans you. It's not a good look, Coda. If that tooth has gone right through, that goes straight into his lungs. My biggest concern is really twofold. How much damage have Coda's jaws done to Homer's internal organ? And then infection. A dog's teeth carry a lot of bacteria. If they've been forced in underneath that shell, we could be looking at a really serious problem here.
I think she's got some head fractures, so we'll just get her out, make sure she's breathing okay.
At the Bondi Referral Hospital SASH, 5-year-old Betty has arrived with shocking head injuries after being run over.
Goodness me, that's definitely a broken jaw. It's just crunching under my fingers.
This just looks absolutely horrendous. I mean, this little cat's skull has been crushed by a car. I think she's got broken jaw. I think there appears to be fractures possibly around her eye as well. Her whole head has basically been squashed.
Owners Linda and Max are heartbroken.
We couldn't have children. She's the daughter I never had.
Brain injury and vision loss are the major concerns.
So we have to really look at those injuries that she's got to her skull and also have a look at if she's got any injuries in her chest, because if her head's gone right under the car, you know, it's possible that her chest has been squashed as well.
Betty urgently needs full head and body scans.
She's our baby, so go ahead.
Okay.
Whatever it takes.
He's at quite a bit of risk of infection here. So I just want to scrub around here and just see if we can remove a few of the bugs that are around these holes here.
Homer the turtle is lucky to be alive after finding himself in the jaws of the playful Coda.
Keep on circling. Yeah, Coda. You got to feel for Jodie. She's been put in charge of Homer and all of a sudden the worst possible scenario has unfolded. Coda has bitten into Homer and left 2 big bite wounds. When I push the forceps in, we're actually losing them in there. There is a hole in there. Homer's been lucky in one way because one of those bite wounds hasn't penetrated into his lungs, but the other one is quite deep. And that's the one we're going to have to pay very special attention to make sure an infection doesn't develop. There we go.
A shot of antibiotics will help fight off any infection, but Chris is also worried about another nasty injury.
He's also got this big crack here. Was that caused by Coda as well?
No, that was from a fall.
Okay, so he's had a fall before this,
Yeah.
not with you?
No, since my little friend down there's had a go, it's, worse.
This needs to be fixed though, because you can see each time it drops down, it pushes into his neck, which is going to really inhibit how well he can breathe, and it's going to get in the way of his leg as well.
Chris needs to take Homer back to the clinic for some structural repairs.
Can it be okay without him? Probably going to enjoy the lack of responsibility for a while.
Get out.
Another wee. definitely need it waterproof, so the aqua's going to be the go. Okay. Good stuff.
Chris and Homer have made a detour on the way back to the clinic for some unusual medical supplies.
The boat repairs. It's close enough to a boat, isn't it? Got a special one for you. Meet Homer. Homer's been chewed on.
Oh, it's not your regular chew toy.
On his
No, it's
first
not.
day
So
as
got
babysitter
a tooth
Jodie,
mark through
Homer
here.
found himself at the mercy
And
of her
here.
golden retriever Coda.
He's got a big crack here. If he was to tear that off, it's just going to rip his whole neck right open.
Oh, poor baby. What the heck is that?
Yeah, it's for boats. Boats go in the water.
Turtles go in water?
Makes sense, huh?
Yeah.
The game plan is to use this putty to put across that crack there, and then once it hardens, it'll really lock that bit of shell in place. And the important thing about this is it's waterproof. So once he is better, he can actually go in the water and not worry about this falling apart.
The putty Chris is using is non-toxic, but this is a job for the professionals.
Got me. It's been taking too long, and he wants it over. Sounds good.
With the panel beating finished, Homer can now take his shell for a test drive.
Come and get me, big guy. Come on. Yeah. Oh, jeez.
Homer's definitely on the move and on the mend, but the wounded reptile will be kept under watch at the clinic to ensure the antibiotics have stopped any infection from Coda's teeth.
I'm not sure if it's a good thing or a bad thing. You actually can't see my handiwork now.
All right, Bubby, let's see if we can do this scan.
5-year-old hit-run victim Betty is about to undergo a CT scan to reveal the extent of her horrific facial injuries.
If you think of the size of a cat's head and the size of a car, and the car going over the cat's head, squashing her face, her brain has got to have had a bump in there as well. So whether it's just a mild concussion or some more serious brain injury, only time's going to tell. There's the jaw fracture. Just there, you can see her lower jaw has basically been split in two. The two sides of her jaw are basically working independently of each other and just hanging there in space. It's got to hurt.
Hey, sweetie.
Incredibly, Betty's chest and other internal organs have not been damaged, but the much-loved pet is just hanging on.
Hello, princess.
Linda's bond with Betty is really special because Linda's actually had health issues herself, and Betty's the one who sat on the bed with her and helped her through her problems.
Betty looks after wife, if wife's a bit crook sort of thing. They seem to understand each other. If Betty's a little bit off colour, Betty goes to wife and vice versa.
This is a tough situation for everyone. Betty is a mess. She's got a fractured jaw, she's in shock, and we can't give her an anaesthetic now because if we do, we could kill her. This is just one of those horrible catch-22s.
Fingers and toes. Please cross your fingers and toes too. And now we've just got to wait and hope.
The next day, Chris has an appointment at the Randwick Racecourse, joining the team of on-course vets.
How you going today, Jimmy? All right.
It's his first time, but he does have some family history.
My great aunt was a pioneer. She was actually the first ever drug tester out here, but ruffled some feathers because she got a few positives, so just hoping out here they're going to welcome me today. Let's see.
Reaper Delaga, number 14.
Heading the team is Chief Vet
Good to
Craig
see you.
Suan
Brown, nice to
and
see you.
Chris's old uni mate, Mark Shenbury.
I'm a bit worried, Doctor. Back in the university days, Chris around a horse made me very nervous. I hope you've improved since then, mate. Do you know how to take blood from a horse?
Horse has got veins. Yeah.
That's a good
I'm
start.
sure of. It's going to be okay.
So we better get stuck into it.
Okay, no worries at all. So I've been instructed by the stewards to get a pre-race blood sample.
Oh yeah, no problem.
Is that okay?
Please carry on, yeah.
No worries, this is number 6 in the
Yeah,
first.
that's right, yeah. Larky.
Is this one in the first as well? I'm not testing you, you're okay. You're a very good bet though. You're every chance in this first race, I promise. Hey, buddy. A little prick, it's all right. It's okay. It's okay.
Good boy. Good boy.
In these pre-race samples, we're certainly looking for things like stimulants or anabolic steroids, but one of the most commonly detected substances is bicarbonate of soda, the same stuff you buy in the supermarket. And it's meant to buffer all that lactic acid that a horse produces during a race and means they can run for longer and ultimately run faster. So they've all got the same number, B067779.
6 vials of blood will be taken and tested for a range of banned substances.
So we'll go off to the lab now and get those results in about 10 days.
Perfect. Thanks very much.
No worries at all. Good luck.
Chris is now heading out where the real action begins.
You keep your eye on things, Pete.
Vets are required to be at the barriers for the start of all races, in case one of the thoroughbreds gets hurt or is deemed not fit to race.
Loading or not? Yes, no.
I'm actually quite nervous about this race because 2-year-olds are notorious for being difficult in the barriers.
We're chasing him, Charlie. Hang on.
It's new, it's foreign, it's scary for them. Anything could happen.
Come on.
I don't know how long we can leave.
Yeah, I know. It's getting to a point where we've got to, if she's stable enough, take a calculated risk so we can get this side of it done.
Surgery on Betty's shattered jaw has been scheduled today with specialist Andrew Marchevsky, but in the past 24 hours, Betty's condition has suddenly deteriorated.
You know, she became so anemic so quickly. I think if we'd have operated when she first came in, you know, she'd have died on the table.
No, darling, we need to get you sorted, don't we?
The trauma case is always a balancing act. There's never a perfect time to do a surgery. You've just got to be a time that's the best given the situation.
Oh, good kitty.
That is your plan. You need to work towards
I have to make it look like that again.
Now that you're a qualified cosmetic surgeon for cats.
Yeah, I'll make it look better than that.
So we're just going to, first of all, stabilise the jaw so it's nice and solid. Get her occlusion, so alignment of her teeth right. And then once we've done that, we can then suture all the skin back onto her mouth. So it's a bit nasty.
You can make a jaw heal any way you like, but it's very unforgiving. It's got to be pretty perfect.
So you can see that tooth there is fitting in nicely just in that right spot there. Yeah, I do a pretty good job.
She still probably has some potential brain injury there. So hopefully now we've got a facial trauma controlled as much as possible with this surgery. We'll be able to really see what her brain's doing.
This is the only one to start, so this will be fun and games.
Righto, Lance, give him a call, mate.
At Randwick, a 2-year-old race is about to begin, and the novices are making everyone nervous.
If I see a problem, I just yell out to you, the starter, and
Straight in, mate. Jay forward, be ready to go up after him.
Worst case scenario here is if a horse actually goes through the barriers or rears up. If they do that and they get something caught, then I could disqualify them, and it's a big deal around here.
One up the mile.
Suddenly, horse number 8, Mandalong Court, spooks and takes off from the barrier.
It's got one that's bolted off down there.
Yeah, and the saddle might have slipped too. We'll have to check that one.
Wow, it's moving. He'd win races with that sort of speed, but he's going the wrong direction. You see that Clark of the course has gone off to chase this horse that's raced off. The concern is this horse may not actually be able to race a normal race, so it may be scratched now.
We're having a look at it right now. They said it went hard. Did it go hard, Chris?
He's got a really fast heart rate there, and also he's sweated up. You can see the veins all across his skin there. My feeling is he'll be scratched.
He just got a bit stage fright and decided to run his race a bit early.
Mandalong Court will be scratched by the vet. Righto. We got him here for some reason, not just to stand around and look good. He's got to do a bit.
Now the vets are hoping the rest of the runners can get away without any more trouble.
Just got one just shifting in here now.
Hand down. Righto, ready when you are. Be ready, Jim. Straighten them up. Well done. It's all go, isn't it?
It is, yeah. It is all go. It seems like we're picking on you today.
Oh, it does. You're very suspicious.
So I just need a urine test from you.
It's been a hectic day for Chris at Randwick, and his vet skills are about to be tested one more time.
When you need a urine test after the race, you can't just walk over to the horse and say, hey, pee in the jar. So you need to whistle.
Surprisingly, racehorses are trained from an early age to urinate in response to the sound of whistling. So the testing can be carried out efficiently.
That's probably enough. It's all in the whistle. Thank you. Like I'm wearing gloves. So they're tamper-proof now.
Have you learned a lot today, Dr. Brown?
Shambury, I have, but apparently your job here is looking very shaky.
That's okay.
Very shaky. I was short price favourite to fail today, but I've come up okay. So I'll see you next week. What the conversation we had before about me being now the new vet.
Indeed. Look, for sure. Yeah, I think, yeah.
No, Doctor, he's not replacing me.
He needs more practice.
Great day. That's a big success. Thank you.
None of this.
Thank you. Thanks, Peter.
Thanks, mate.
Great to work with you guys. See you all next week. All the best, Mark. You'll be fine. It'll be great. Some kennels need some cleaning out at our work, actually, if you want to do that.
Betty! Are you talking?
Brave Betty has made it through the surgery to reconstruct her shattered jaw.
And come out?
The tough cat head-butted a car and lived to tell the story of her incredible escape.
Oh my goodness. Practically jumping out. Hey?
Her jaw's healed nicely, she can see, and most importantly, she doesn't appear to have any brain damage, which is just fantastic.
Hey. Oh, my darling girl.
Hello.
Look, you've even got
For Linda and Max, the ordeal is finally over.
Oh, trying to get away. Yeah, she's back to normal.
Yes.
There's been a bit of a brain transplant because she's actually quite nice now rather than aloof, so that might change. She might go back to normal.
She just won't be allowed outside. Are we listening, Max?
Right. Yeah, no, that's right. Yeah.
Don't look at him like that.
Chris is returning the patched-up Homer to Jody. The unrepentant Coda has been banished to the balcony.
The big issue with Homer now is water, because I don't want him getting water in these.
Okay.
I don't mind if his head goes under, I don't mind if the base of his shell goes under, but those two holes can't go under water.
Homer's battle scars will take at least 3 weeks to heal, but his owners will be back from holidays before then.
I'm going to have to bite the bullet and tell them I'm not very good with secrets, especially when there's 2 big holes to prove it.
I often say it, but in this situation I really mean it. Good luck.
Thank you. I'm going to need it.
I've done all I can for Homer, but really I think the safest thing for him is get Coda a dog toy, one that's not living.